Does your back ache? Do your knees creak? Do you have a stiff neck? Over 100 million Americans suffer from chronic pain, but that doesn't have to be you.
I am going to show you that there is a non-invasive, simple, and effective method to relieving your pain, and it's called the Yass Method.
Dr. Mitchell Yass will show you simple, effective techniques that have helped thousands of his patients, all without dangerous drugs and painful surgery. His revolutionary approach diagnoses and treats the cause of your pain so that you can be pain-free forever and live the active, healthy, and happy life you want, no matter what your age. So stop suffering in silence with chronic pain. Join Dr. Mitchell Yass and learn what you can do to live a pain-free life in The Pain Prescription.
Do you want to live pain-free? I mean, really pain-free? Do you want to remain independent? Are you having difficulty with walking, stair climbing, or even standing up because of your pain? Needing help from canes, walkers, or others assisting you? Do you want to avoid unending dependence on drugs to mask your pain? I'm sure you do. I'm Dr. Mitchell Yass, and I've created a new method that shows you what is causing your pain and a series of techniques that anyone can do that can then resolve your pain and prevent it from returning. How does that sound to all of you? More and more Americans are suffering from chronic pain right now. Maybe you're one of them. More people suffer from chronic pain than suffer from cancer, diabetes, or heart disease combined. Imagine that. And that's not the only pain that we're dealing with, right? We've got back pain, neck pain, shoulder pain, knee pain. The list is long and keeps getting longer. I'm here to show you that there's a reason for hope. You don't have to be one of the millions of Americans living with debilitating pain. Let me tell you a story about a patient named Ed. Ed was told that the cause of his knee region pain was a meniscal tear simply because the meniscal tear was found on the MRI. He ended up getting surgery and then came to me for post-operative therapy. After treating Ed for post-surgical symptoms, he noted that he still had the very same pain he had prior to the surgery. I asked him if he wanted me to evaluate him to establish the cause of the pain. I determined that Ed had strained a hamstring and the tendon that attached the muscle near the knee region was emitting the pain. I treated Ed using a targeted strength training program, and within weeks, he was pain-free. Just imagine a few basic exercises and his pain resolved. Ed was able to perform all functional activities, including playing golf, that he had missed for years. When he saw his orthopedist and told him that I had relieved all his pain by treating his hamstring, he asked a simple question: was the surgery necessary? The physician said, maybe yes, maybe no. I guess we'll never know. Do you believe that? I find it hard to believe. It's true that sometimes surgery may be necessary, but I am going to show you that there is a non-invasive, simple, and effective method to relieving your pain, and it's called the Yass Method. And when dealing with pain, it should be your first stop, not your last resort. The good news here is that you can avoid going through what Ed went through. I have seen in my practice that in 90% of cases, the cause of pain is muscular. The Cleveland Clinic, in its newsletter, Arthritis Advisor, stated that most back pain is muscular. That's from the renowned Cleveland Clinic. And the best news of all is that pain can be resolved through a targeted strength training program. My method doesn't simply focus on reducing your pain. It provides you with the goal that you have been seeking and the reason you came to the medical system for help: a full return to full functional capacity, doing what you want when you want to do it. My system establishes what tissue is creating the pain and resolves the distress of the tissue. This allows the tissue to return to normal function, so even the simplest daily activities can be performed without symptom. Masking pain with drugs or injections doesn't make these tasks any easier. By the time the show is over, you will see that there is a logical, analytical approach that can be used to set you free from pain and allow you to have the fun and fulfilling life you deserve. Sounds good, right? Yeah. Who wouldn't want to have fun again? I have been a practicing therapist for over 20 years. I have a doctorate in physical therapy. I had my own private practice for 15 years. I have treated more than 10,000 patients in my career with an unparalleled success rate in resolving their pain and returning them to full functional capacity. When they were finished, they could do what they wanted when they wanted. Over my career, I stopped innumerable patients from getting unnecessary surgeries and resolved the pain of countless others who unfortunately had unnecessary surgeries that did nothing to solve their pain issues. Let me share the secret that has allowed me to achieve success with the patients I have treated to date. As a general rule, pain occurs due to people trying to perform functional activities, but not having enough strength in all the muscles responsible to do so. The muscles strain, emitting pain, or alter the joint surfaces of the joints that they attach to and create pain at the joints. Most people don't realize that pain at joints can come from surrounding muscles. In rare cases, you have deterioration of structures like spinal discs, the meniscus at the knee, or arthritis develops, but the cause of these structures varying is still the same: muscle weakness or imbalance. The key is that pain and functional capacity are joined together. If we are going to address pain, I think we need to start by beginning by defining pain. I have always described it as the body's attempt to create conscious awareness of a tissue in distress. The way the body identifies whether a tissue is in distress is through pain receptors that are contained in connective tissue that can be found in most tissues of the body. When there is distress, the pain receptors are ignited, causing a pain signal to be sent to the brain to create conscious awareness of the distress of the tissue. This is so an intervention can be introduced to end the distress of the tissue. Once ended, pain ceases. It's that simple. Resolve the distress of the tissue, and pain will no longer be emitted. One point that must be made about pain is that there seems to be a false narrative being created amongst the medical establishment, pharmaceutical companies, and even some promoting Eastern medicine philosophies. There is the promotion that pain and inflammation are synonymous. This could not be farther from the truth. When inflammation is present, the symptoms are typically pain, swelling, and heat. Examples of when inflammation is present are ankle sprains and contusions. In these cases, you would see the 3 common symptoms indicating that inflammation is present. Now think about a kidney stone, a heart attack, a paper cut. All of these present with pain, and yet there is no swelling or heat. Know your symptoms. Pain alone does not mean inflammation. Pain alone means distress of a tissue. Pain, swelling, and heat means inflammation, and this is a time when an anti-inflammatory might be required. A great example of a patient who did not have the pain signal resolved even after 2 years of treatment was Bob. Bob had pain at the gluteal or buttock region. He had the standard testing, which included an MRI indicating herniated discs and stenosis of the lumbar spine. Over 2 years, he had 6 epidural nerve blocks, 1 cortisone shot, and something called radiofrequency ablation, which is an attempt to burn the nerves to stop them from sending pain signals. Notice, all treatments designed to mask pain, not resolve the cause. I used the Yass method to determine that the cause of the pain was a strained muscle due to other muscle straining. Through my method, I identified the tissue emitting the pain signal while the MRI had not. A few weeks of treatment, and Bob was fully functional, playing golf 3 times a week. How many of you would like to get back to the things you love but can't because the right cause of your pain hasn't been identified? There is nothing wrong with admitting that sometimes what appears to be a great step forward in medical advancement is simply not working. The MRI has been proven to be invalid by many medical organizations for the diagnosis of pain. The American College of Physicians, in fact, now recommends that the MRI no longer be used to identify the cause of lower back pain. In my own work, in case after case, I found that the MRI was finding structural abnormalities that had nothing to do with pain. One major medical study concluded that the findings of structural abnormalities, such as herniated discs or bulging discs and pain, may simply be coincidental. Let me give you an example of just how fast the Yass method can identify and resolve pain. Helene came to me just a week before she was going to Hawaii for her 20th wedding anniversary. She had been suffering with sciatica for weeks. She was diagnosed with a herniated disc that was found on an MRI. At evaluation, she asked me if she was going to have to cancel her trip. I told her to wait till the middle of the week to see if she would be able to take the 11-hour flight. I established that sciatica is actually the result of a muscle in the gluteal region called the piriformis impinging on the sciatic nerve, not from a herniated disc in the lumbar region. I treated Helene based on the principle that the cause of her sciatic pain was from strained muscles. I had to perform a targeted strength training exercise routine over the next week, and sure enough, we resolved the sciatica. She went on her trip and had a very romantic anniversary. How many of you would like a little more romance in their lives, but you can't because pain is stopping you? Let's be clear. I am not saying that the MRI is not a good technology for some reasons, such as to rule out cancers and strokes. It is simply not effective for identifying the cause of pain. One study had shocking results. It concluded that of those over the age of 60, 90% of those who had no lower back pain were found to have degenerative or bulging discs. Doesn't this statistic make you question whether your pain is coming from a bulging disc when so many people can have bulging discs and have no pain? It just doesn't add up, right? If you're having a hard time accepting how it can be that these types of findings can occur with the MRI and yet have nothing to do with the cause of your pain, let me give you a specific metaphor to show you. Let's say that we look at a car and I take a sledgehammer and bash in the driver's side door panel. And then I let all the air out of all 4 tires. The tires are now completely flat. Then I get into the car, I turn the car on and put it in gear, but the car doesn't move. Why isn't my car moving? Well, the door panel is definitely bashed in. You can't miss that. That's what basing your diagnosis on an MRI is like. Correlating specific causes with specific symptoms is at the heart of my system, and what the MRI misses time and again. By understanding which tissue is creating the pain, the proper treatment can be performed to resolve the distressed tissue. Can an MRI identify whether a muscle, bone, or nerve is in distress and emitting pain? Let me ask you this. Does a muscle spasm show up on an MRI? If a muscle refers pain to another location, does this show up on an MRI? If a muscle impinges on a nerve and it refers pain to another location, does this show up on an MRI? No. And if all of these muscular causes don't show up on an MRI, then how can the proper treatments ever be prescribed? I have proven that in 90% of cases I treated, the cause of pain was muscle weakness or imbalance. Therefore, there are a lot of people being misdiagnosed and a lot of people not getting the proper treatment. Do you think you're one of these people?
Maybe.
Your body wants you to know what is wrong with it so the distress can be corrected. It is providing you symptoms and clues. My system interprets these indicators so the right tissue can be treated and resolved. The population is getting older, and the #1 fear of most is loss of independence. Pain can take this away from you if not treated appropriately. Independence to perform daily activities is what everybody wants. And my method can lead you to this end. I have done this for thousands of people, and I can do it for you. Now let's move a little deeper into the difference between my method and the traditional approach. You may be wondering just how big a deal pain is. Well, if you're in pain, you're probably not. But just for some perspective, chronic pain costs America $600 billion a year. That's with a B. Billions of dollars lost in productivity and medical procedures. That's a huge financial incentive to listen to what I've got to say right now. I believe that the medical system has many amazing aspects to where great things are accomplished. Cardiac care, cancer treatment, dermatology, and emergency care are aspects of the system where success can clearly be seen by any statistical analysis. In the treatment of chronic pain, the results are discouraging and very concerning. I've seen this firsthand, and I'm sure you have too. Studies have shown that a large majority of the population who have no back pain have herniated or bulging discs, while an even larger majority of people with back pain cannot have their pain attributed to spinal abnormalities like herniated discs or stenosis. But most people don't need studies to see how unsuccessful surgery has become. Almost everybody knows somebody who had a back surgery that still had pain, sometimes even worse after the surgery. It is estimated that the failure rate for back surgery is somewhere between 50 and 70%. 70%, that's astonishing, right? Yes. The medical community had to coin the phrase failed back surgery syndrome to provide a diagnosis for those who suffer from pain after surgery. Studies have shown that surgery for arthritis of the knee or injections of cement for compression fractures of the spine fared no better than placebo surgeries, surgeries where nothing was done. For me, the real tragedy is that in all the patients I have treated who were scheduled for surgery, the symptoms the patient was presenting clearly indicated that the structure that was identified could never have been causing the symptom in the first place. So it didn't surprise me that in people who had surgeries, the pain still remained. Your pain will not be resolved if the tissue creating the pain is not identified correctly. It's that simple. The existing model fails in the most significant component of treating chronic pain, identifying the correct cause. The Yass Method is designed specifically to interpret your body's symptoms and presentation to correctly identify the distressed tissue emitting the pain. It will identify the proper bone, nerve, or muscle. How many of you have had pain and were told you have a herniated disc, stenosis, or arthritis as the cause, and then took a hot shower and it felt like the pain decreased, if not resolved? How would a hot shower change that scenario? Clearly, the cause of the pain is not these structural abnormalities. Most likely, it is muscular. Let me give you a couple of examples of how my method uses more in-depth techniques to identify the correct tissue emitting the pain without the need for X-rays or MRIs. These techniques are easy to perform, and I am confident that you can perform them at home once you understand what you are trying to do and why you are performing the techniques. The first technique is called palpation, or in other words, feeling tissues in the body to see if they are the ones igniting the pain signal. This, to me, is one of the quickest and easiest ways to determine if the pain is coming from a spinal abnormality, like a herniated disc or stenosis, when pain is being experienced in the neck or lower back. You are trying to push on tissues and see if you can reinforce the pain you are experiencing. Let's say you are having pain at the area of the neck that travels from the neck to the shoulder. This is actually called the upper trap region. You get an MRI that says you have a herniated disc or stenosis causing your pain. You want to confirm or refute that diagnosis. Here's what you do. You try to press in the upper trap region and see if you can bring on the pain you typically experience in the area. Why is this so important? Well, the diagnosis from the MRI says that the pain is coming from the spine. This is known as referred pain, meaning that the cause of the pain is in one location, the spine, and yet the pain is being experienced in another location, the upper trap region. If a herniated disc or stenosis was the cause of your pain, you would have to press on the spine at the level of these abnormalities to create the pain at the upper trap region. You can try this, and most likely, you won't create any pain. Now, if you press on the upper trap region and you recreate the pain, this means that you are pressing on the tissue in the same place that the pain is being experienced. This is called point tender pain. This means that the tissue you are pressing on is the tissue emitting the pain. In this case, you are most likely pressing on a muscle called the levator scapula, which indicates that the cause of the pain is a strained muscle, not a herniated disc or stenosis. With one physical test, palpation, I can tell whether the pain is coming from the spine or from a muscle completely without the need for an MRI or X-ray. This is the power of being able to interpret what the body is presenting. The body doesn't lie. Here is an example of a person who found herself in the very quandary I just described. Her name is Susan. She had pain and tingling at the upper trap region for over 2.5 years. She was diagnosed with stenosis of the cervical spine. She tried medications and epidural nerve blocks. In fact, everything short of surgery. She actually said this to me. She said that getting surgery was like going to Las Vegas. You could win big and have your symptoms resolved, but you could also lose big and make things much worse. Upon evaluation, I determined that the symptoms she was experiencing in the upper trap region were from strained muscles that were associated with the shoulder and shoulder blade. Since this region is associated with the neck by the medical establishment, the typical process is to look for structural abnormalities like herniated disc or stenosis in the cervical spine. That is what led to the 2.5-year ordeal for Susan. It just didn't have to be like this. A simple understanding of her pain being associated with shoulder dysfunction and not neck dysfunction allowed for the proper targeted exercises to be performed, and within 2 months, her symptoms were fully resolved. She had her life back. she could perform all activities, including driving safely, now that she could turn her head fully and had normal function of her neck. Just imagine how good it felt to be able to sleep in her own bed after only being able to sleep in a recliner, and drive to the mall to shop all by herself. That's from using my method. And if she had tried it first, she could have saved 2.5 years of suffering. That's what I'm trying to tell you. The pain that you're feeling right now doesn't have to haunt you forever. The Yass Method is simple and effective and non-invasive. Let's look at another technique, range of motion, to see how it helps to differentiate the cause of pain. When we are talking about range of motion of a joint, we are looking at two types of motion, active and passive. Active motion is the individual's ability to move the joint through motion. Passive motion is the ability of a second person to move the individual's joint through range of motion. For instance, let's say a patient is having pain at the shoulder, and I want to determine whether the cause of the pain is coming from the arthritis that was identified by an X-ray, or a muscle weakness or imbalance causing the patient to not be able to raise the arm over shoulder height.